and she was the only thing that I kept saying, like, oh my gosh, she's so pink, oh my gosh, she's so pink. She was really pink and not too much wrinkles, and she was just so wet. For her hair was wet, and oh my god, because she was right here. I couldn't see her properly because of my, you know, angle of view, but I was like so loopy also from the anesthesia, and I was like, oh my gosh. And then she stayed there like about 5 minutes, which felt like such a long time, and it was really good. And then they took her to the nursery, and we did with Daddy, of course, and my husband went with her, and they said that he could come back, but he didn't probably understand what they said, so he stayed there. And after he left, I swear I got so sleepy. I really got so sleepy, and I asked the anesthesiologist if I can sleep. You know, he said, just go ahead, relax, you know, it's nothing to worry about, it's normal. So I just slept so much. Oh my gosh. After that I was really sleepy all the time. And then after they finished, oh, she was born 10:15, so the whole thing lasted for about, I don't know, 30 minutes to 40 minutes. I don't even know when they started. And what did they do? Oh, they fingerprinted me while I was in the OR. I don't know, it's a procedure they're doing right now, which is a good thing, you know. It's a good thing. And they footprinted her and everything, and it was great. So they changed me from the table to the other bed, you know, and took me to the recovery room, where you have to stay like at least 2 hours, unless, you know, you need more time, because you have to wiggle your toes, and if you can't do that, then you're okay to go to the postpartum room. So I was wiggling my toes and everything. After like 1.5 hours, it was fading away already. But oh my gosh, boy, did I feel those contractions, uterus contractions. They felt like a volcano erupting in me, and oh my goodness, I could see like bubbles of mountain in my stomach, just boom. And I could hear it too, so that wasn't very comfortable. After that, oh, my husband came in and went and came in, and he said that if I knew I could come in earlier, I would. And they said, yeah, why not? You can stay here as much as you want. The baby's in the nursery, everything's okay. So she's still eating. Everything was really good, and I was happy, you know, even though I was scared from the previous thing, but I knew that I have to go through this to get my little bundle of joy. So what happened next? I was so loopy, and they said that if you need a drug for pain, just let us know. So they injected me. I forgot the name. Oh my gosh. There. I'm saying it in my video, but right now I forgot, you know. Okay. So they gave me Demerol shot. Oh my gosh, I already forgot the name.
Amber cake. Can I eat cake without?
So they were injecting it right on my shoulder, and this area was sore because of the injections. They probably gave me 5 or 6 during my 3-day stay. No, the second day they started giving the pills. So in 1.5 days I got like 5 or 6 shots, but I could not survive without those, and it was so painful. I came to my postpartum room, and Amy came, and she was like, "Mommy, baby's so cute." And that was cool to hear. And they have a visiting hour for the kids from 4 to 5, which was a really short time, and she was coming and going with my mother-in-law and sister-in-law, and I was just missing her so much. I'm breastfeeding from day 1. It has been going great. The lactation consultant came, and she was trying to teach me some stuff, but the baby was sleeping, so all I learned is by
Mommy,
myself.
I have something.
Well, good. I learned all by myself and from the internet and stuff, and reading all that, really helpful. So right now she's latching out good, but you know, feeding every hour or so, and every feeding lasts about 30 minutes to 1 hour. If she's really hungry, she will feed 1 hour. Really slow. She's just sucking really slow, and I don't care. Even though I'm sleepy, sometimes my eyes are closing. If she needs to get it, she has to get it. And so today there's sun finally, and I put her to sun a little bit because she has a little bit yellowness on the skin. And we did a couple of blood tests, so it's going down the level of jaundice, so it's good. But when they did the blood test, it was really emotional for me. I don't know why. And the nurse said that probably you're breastfeeding, that's why your emotions are really high. True, maybe. I don't know. Everything is so different with the second one. So, what was I gonna say? Okay, back to the hospital thing. So, I went there and I really wanted to get out of bed as soon as possible. Even though it's so much pain, and the first day I was just stuck on the bed and they were washing me, cleaning me, brushing my teeth, and I was stuck to the catheter for the
Mommy,
urine.
give me, I'm trying to do.
The second day I told them to remove it, and you have to get up and walk, and I did that. It was really painful, but after second step you feel better and better and better and better. And we had the breakfast, lunch, dinner. We had housekeeping every morning, and it felt like aside from the pain, it felt like you're staying in a little hotel with a little nice view of Arizona Bridge, and it was really cool. The bathroom was inside the room, which was fantastic. Last time I had to walk like so far to, you know, use the restroom, and this time it was right there, right in front of my bed, and all I had to do was to make like 5 or 6 steps to reach there. I needed help so much, and my husband stayed with me during my 3-day stay. Only left for 1 day, and not 1 day, like for 1 hour, go and take a shower, come back. And he was really, really helpful. He was waking up whenever the baby was making fussy sounds, and he would change her, and if she needed feeding, he would bring her to me, and I would feed her. And he would feed me my breakfast, lunch, and dinner while I was breastfeeding my baby, and it was just really fantastic. Like, I could feel that he's maturing too, and everything changed from the day that he went to the OR, and it's so amazing right now. We all matured so much, you know. We just
go to pee-pee.
Go pee-pee, honey. I don't know, it felt like right now we're complete, and we just became complete parents of 2 little angels, 2 little and big angels. And yeah, she's going peeing. Oh, I babbled too much, but I have so much to say, guys, and I know you guys been waiting for the video, and so here it is. I'll show her it later, and she stops feeding. I'm a mess, and oh, I got my stitches removed on Wednesday. Yes, Wednesday. And I was freaking out because I didn't remember how it felt like removing the staples with my first C-section. I was freaking out. I even read on the internet and stuff before I go. But it didn't hurt at all. All she did was snip, snip, snip. I could just hear the snip, snip sound, and she said that the only thing that could hurt you if I pluck a hair or something. And she said that I took out 2. Did you feel anything? I said no. And that was it. She just sanitized it, and she said I don't like usually putting the tape on, but it's a procedure that we have to put the tape on. So she put a tape on, and she said if it doesn't fall in the shower, then don't worry, it's gonna fall. If it doesn't, then when you come back for your postpartum checkup in 2 weeks, yeah, in 2 weeks, then they will remove it. And that was good. After she removed the staples, I felt better, and I felt like walking better, so that was good. I've been out up and running, like doing chores and stuff since Monday, which was the next day that I got discharged. I got discharged on Sunday, the 14th June, and that was good because before I stayed like 7 days in the hospital with my first C-section. And right now it's only 3 to 4 days.